but it usually will catch the whole thing. How is everybody else feeling today? Good, good to hear.
Good. How about you?
Good.
Well, as I was saying, I've bad sinusitis. You can see my face swollen.
Yeah.
Yeah, it's pain up to there, up to the
Oh my
eyes.
gosh.
But it's better today than it was yesterday than the day before. So we're
Well,
moving in the
good.
right direction. Yeah.
Yes.
Something I suffer with. I do suffer with it. I've had so many surgeries. I don't even know how many sinus surgeries I've had. That's how bad.
Wow.
So just got to jump on it quick and take care of it. How is everybody else today? Any comments, concerns, need to know anything? Javon, that was not a nice one. You look like my grandson. That's my grandson's favorite emoji. The only reason why I know what it is. I had my grandson all weekend, so it was a blessing. You don't feel well, but the grandson's here and he just makes everything better. He says, "It's okay, Nana, I'll spoil you because you spoil me." Okay. Well, we're back to Christmas. So you know that after class today at 5:30, I'm doing the first review for the exam. You all have been given the PowerPoint ahead of time, so you should have had it from was it Saturday or Sunday when I finished. I did go through all of it, made sure that things that will be on exam, HESI, and those NCLEX questions that students have told me, I know they're on there. So it's a global help for you. And it's not 1,000 slides, it's 88, but many of them are like a question and then you turn a page. So it's not crazy hard, not like really long.
Thank you.
No, you're welcome for sure. The second review is going to be tomorrow with Professor Morris, and the third is on Friday with Professor Okorafor. Remember, you get every single recording. You will get all of that access. Of course, I'll have it posted on the YouTube channel for you all too, so that you'll have it not only in announcements, you can go to the YouTube channel if it doesn't open, because that seems to be an issue. And I don't want, when you have that moment to study, for the recording not to open, because that would frustrate me. And especially if I can't answer right away, because I know your time is precious. You guys are busy. So I wanted to, this is why I started that YouTube channel, to make sure that you got what you needed when you needed it. Because I've had those issues in the past. Not that I did it wrong, copied it wrong. It's just Zoom was just being picky. So has anybody gone to the Professor Bogart Pediatric Nursing YouTube channel? Have you seen it?
Yes.
It's recordings from other classes. You'll see yours listed as T 3 to 5, and that will be your class. I've already put the 2 Monday classes I did on there. So you want to listen to another, session of what I've done? There you go. They're slightly different, I don't say the same words each time. I'm going to be giggling with Javon all afternoon with his little emoji. That's exact. My grandson would do something like that. Little Christian. All right. So let me see. 5, 10, 15, 22. We'll wait 1 minute and we'll get going. We've been ending about 20 to the hour. So it's, you get like that break time back that, you haven't gotten in the last 2 weeks, because it's been so compacted with a lot of information. This PowerPoint is slightly less, although the Kahoots is still 50 questions. I think those Kahoots really open your mind to concepts, and I do not want to cut them out on you. The PowerPoints, I can put a lot of stuff in the Kahoot so they don't have to completely explain in the PowerPoint. So this is my double way of making sure you're getting what you need. All right, we're on record already. Week 3 already. Wow. It's going to go by very, very quickly. Next week is your first exam. It'll be done during class time. So come to class a little bit earlier, about 9:45, 10:00, so we can set you up. Remember, I'll need an ID. You need just a pen and a piece of paper and a side view. So come in on your cell phones, as the view, or another type of computer, pad, whatever, and then have your computer so you can do your exams. There is class after the exam. So I probably will tell you to come back at 20 after 4. It usually works to be about there, so that we can just do the Kahoots, so that you're getting the information of week 4 without the lecture, but you're getting all of those concepts that you need. So it's worked out well in the past. Students say that it was perfect. And of course, you still have get the PowerPoint. You still have your interactive PowerPoints, to review, so you're not missing anything at all. And it still gives you the information. So Burns is open. Has anybody had an issue trying to open it? Okay, you all are good. Remember, when I have these case studies, they're not open till the week that they're due. And then I have them one week more, just in case you missed the date. Remember, after Sunday, it'll be minus 10%. But if you get it in before Sunday, 11:59 Pacific time, you'll get your full credit. Make sure you go through the modules. I do not accept screenshots. My dean does not allow me to accept a screenshot, only in rare circumstances. I'm not telling you never to take screenshots. I would if I was a student, just in case there's an issue. I wouldn't want to have to do a case study again if I didn't have to, especially how busy you all are. So make sure you go through there. So far, the grades are coming out pretty good of what I've seen. So, and I was able to do your discussion questions. I was able to get them done today. So there are comments there. If you don't have a perfect 20, go back, look, see what the issue was, so you can get your perfect scores. And most of it is not your content. It's not putting in the body of your information, where did you get the information? Parentheses, Perry, comma, date. I want that in the middle of the paragraph somewhere, telling me this is where the information came from, because you're not experts yet. I'm still not an expert. I've been doing it a long time. So make sure you do cite where your information come from. Your references, you're doing great. I have no problems with them right now. In your level, ADN, I'm happy with the way they're coming through. So good job. So let's go to our PowerPoint. Any questions before we go there? Okay, let's go. So we're going to do school-age children, and we are also going to do adolescents today, talking about the differences in how they grow. We've talked about already infants, we talked toddlers, preschoolers. Now we're getting into the school age, and we're going to be going into the adolescents. So we know that children that are school age are ages 6 to 12. That's a long period of time. That is a young child. And by the time they're 12, they're more mature. There's a lot of difference in there. It starts out with baby teeth and it ends up with all permanent teeth. And they always say it ends at puberty. And puberty is usually 10 for girls, 12 for boys, but we just classify the end as puberty. So remember, these children may look older, they may look mature, but remember to look at their ages as we're describing things. Again, getting on their developmental level so that they can understand, what you're trying to do for them. Your height still grows. It's still 2 inches a year. But for the 6 years of this stage, they can grow 1 to 2 feet. So they're consistently growing. Their weight still goes up. Their weight doubles in these 6 years. And at this point, boys and girls, they're not different. It's like all of a sudden between 8th and 9th grade, the boys who were short and tiny and skinny, all of a sudden they grew a foot and they look different overnight. I always tell parents, because it happened with me, take a picture of your child the last day of 8th grade, then take a picture of your child first day of 9th grade. And you're going to see over that summer the maturity that happens. And I've seen it in many, many children. As they go into school age children and they grow through those 6 years, they're going to become more and more graceful. They're more coordinated. They're all that baby fat's going away. They're getting more muscular. Their faces are looking so mature, looking like, grown children. Remember, still they're not. And it is the age of all I want for Christmas is my 2 front teeth, because their teeth, all their baby teeth come out, and then it ends up with their permanent. Their bladder continues to be able to hold more urine. So on those road trips, they're not going to be, I have to go pee-pee, mommy, and you have to stop the whole trip if you're in a car. So that's a good thing. The heart doesn't fill up the chest anymore. It becomes in more proportion. And because of all of the illnesses they've had and all of the immunizations, their immune system is a lot more effective than even, the preschoolers. Their bones become more ossified. As I said, young children, their bones are softer. They heal easier. And as we look at broken bones, you're going to see that infants can heal in 2 to 4 weeks. And adults, as you get older, it could be 4 months. And that's because of the ossifying of these bones. So that's the difference on how we care for these children. And again, the physical maturity does not correlate with emotional or social maturity. So we say prepubescence is that period 2 years before the age of 13. It's right before puberty. So we know puberty, and I've said it just earlier, is about 10 in girls, 12 in boys. That's why in about 5th, 6th grade, girls think boys are silly and stupid because they're not as mature, because they're not maturing as quick as girls. Now, how are we going to assess these children? Depends on the age, right? A 12-year-old is going to understand more than a 6-year-old. So again, think about the age. If you have a 6 or a 7-year-old child who needs an x-ray, never had one before, if you've ever seen those machines in the hospitals or, urgent care or doctor's office, it's this big thing that goes click, 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 and it comes at you and it looks like it's going to, hit you. So let these children know it's a big camera. It's not going to hit you. It's going to take a picture. They're going to tell you to hold your breath. And then I'm going to show you what your insides look like. I can show you broken bones. I can show you your heart. I can show you your lungs. And we'll look at that later. So they become excited to get an x-ray and looking for the results. Even 10 and 12-year-olds will be excited with that. The abdomen, we inspect, auscultate, percuss, palpate it, to see if there's any problems. Lymph nodes should not be there at all. You shouldn't be able to feel them if they're healthy, normal, healthy. It's when they get sick is when you feel those lymph nodes come up. Like I feel mine right now due to this sinusitis that's going on. Health assessment showed you had to do a physical assessment, and one of the nerves, cranial nerve 9, it's a hypoglossal nerve. And how we test this on children is to stick your tongue out. And we can even have infants do it too. I sit there and they're imitators, right? So it's an easy nerve to check. Checking for breath sounds. Now, children are tricky, especially the younger children, closer to the 6-year-old. These children get upper airway mucus and secretions because of those big adenoids and tonsils. They always have, mucus in their nose. So when you listen to their bronchus in the trachea right here, you're hearing all that upper airway gargling. It's not what their breath sounds are. So be careful. Sometimes I tell nurses, new nurses, listen to their neck. If you hear that gargling there, listen to the lungs. is it different? So making sure that you know where you're placing a stethoscope to understand what you're listening to. So bronchial lung sounds are over the trachea at the suprasternal notch. Now, again, as you see, we do have our theorists that are going to be coming into play. And the theorist is a vein in many of your students' existence because they're hard to understand. So I know that the quiz had several questions and there was confusion with them. I brought them there to show you, you know, you need to find a source that will help you understand those theorists better. You are going to have those things on the exam, on your HESI, on your NCLEX. And it's something that if you can find a book or a YouTube video, something that can help you get it to understand better simplistically, you're going to be better for as you go on and even taking your HESI. So let's go back and let's look at the school-age children in Freud. Well, that is called the latency period. And it's as they start to understand that there's boys and girls, okay? They understand boys and girls, but their relationships are same-sex pairs, girls with girls and boys with boys. It's just the way that they feel comfort. And this gives them security, having that best friend, same-sex peers. Erickson. Now, Erickson, I think the school-age children and the infants are the easiest two stages to understand. So Erickson has a sense of industry and it's a sense of inferiority, right? So the industry, what does industry mean? Well, school-age children loves to do things, do well, and get praise from it. Whether it's in sports, whether it's I write the best, or maybe I do math the best, science the best, maybe I can play the piano, maybe I can bake a cake. Whatever it is, they want to do a skill and they want to do something that, you know, is meaningful. It's something that other children and adults will see and give them praise for. They seek that, they want that. That peer approval is their strong motivator. And it's a sense of accomplishment. Now, inferiority is when they can't kick a ball because they're clumsy. You know, we have children that are athletic and some that aren't. Those children who aren't, find something else they can do. And maybe they are, you know, doing the playing the piano or cooking, or, you know, they understand, you know, spelling bee and do well there. But there's children who don't do everything. So school-age children want to do everything and they can't. So when they can't, it's a sense of inferiority because you can't master every skill. So when you talk about the industry, it's a task they do well. Inferiority is something they just can't do because they can't get praise for it. Now, Piaget. Piaget is now they're thinking about before events happen. They're starting to understand that if I take the garbage out all week long, like mommy says, I'm going to be able to go to the movie with my friend on Saturday. Okay, it's they're going ahead of time, thinking what they call this conceptual thinking, that I know what I need to do to get there. They also are this, what we call the masters of conservation. What does that mean? Well, I'm going to go back to my children and talking about every Friday, Saturday, you go grocery shopping. And I would buy them a box or two of Little Debbie's. And they know if there was 10 Debbie cakes, they knew if they ate more than one, because there's two children, so they both got 5 for the week. If they ate more than one in one day, they're not going to have any for the end. So they conserved it to get there. Another way is how, you know, some of these school-age children, the older ones, do their own laundry. So many schools have uniforms. They know how to conserve their uniforms to make sure they get through the week, so they don't have to do laundry during the week. So just that conservation type things. They understand if a liquid is in a thick, short glass or a tall, skinny glass, if you pour one into the other, just because one looks bigger than the other, it's still the same amount of liquid. Piece of dough, you squish it, it's still the same piece of dough. There's no more or no less. Pennies, different designs of them, it's still the same number. So they're understanding a lot of these concepts now. Kohlberg. Think of Kohlberg, think of moral, right and wrong. Right and wrong, and there's a consequence to be right, which is a good one, or the bad, which is a bad consequences. Now, older children will do things that are bad, even if they're going to have a punishment, if they really wanted to do it and it meant that much to them. They know which they will do and what they will not do. So some children, you tell them no and they still do it anyway. It's because of Kohlberg, who says these children just do it because they wanted to, even though they knew they would be punished. Spiritual development, they are really interested, especially those families who are into going to church or saying prayers or, celebrating holidays. These children really want to know God and want to understand what it's all about and praying. They think that when they've done something bad, that God is going to punish them. So I've had many children walk into the emergency room. A little boy said he's in there with an acute appendicitis. And he says, I'm being punished because I hit my sister yesterday and that wasn't nice. So now I'm being punished. That's what I'm talking about, where God is punishing you for bad behavior. Or I didn't, do what my mom told me to do yesterday, and now I'm being punished. And they really believe that. Now, they also, you talk about the Band-Aid kid. Well, it still goes into the early ages of school age. They feel that if they get cut, they're going to bleed out, their insides are going to come out. So can you imagine sending a kid to the OR who needs an appendix taken out, who feels that God is punishing him? He's going to feel that God is punishing him. His insides are going to fall out and he's going to die. So, and I'm serious. I'll sit with these children and say, listen, you did nothing wrong to make your appendix not want to be there. It's a normal thing. You're not being punished for that. It's just this little piece of tissue doesn't want to be there anymore. So we'll take it out. And I'm going to tell the surgeon, the doctor, to make sure he puts an extra stitch so nothing falls out of you. And you should see the faces, they relax. This is a real fear in these school age children. As I said, peers, same-sex peers, most important on this stage for these children. And these children will switch to other sports because my peer, my best friend, wants to play, soccer, and I wanted to play softball, baseball, and he wanted to play soccer. Okay, I'll go play with him, because they really want that peers. They really influence them of doing things together and changing their minds to do it, to be with that person. Clubs and peer groups are very important. Girl Scouts, Boy Scouts, 4-H, even sports teams, little leagues. It doesn't matter. It's a joining of children, and it's a great thing. It's a great thing to get into a group, to work together, and with a goal. There's a goal in the end, whether it's to get your badges for 4-H or Girl Scouts, or in sports is to win the game. But in any group setting, especially, any group, doesn't matter, adults, children, there's bullying going on. There's always going to be that one kid who said, I got it before you did, nanny. And that's just children. And actually, that's just people in general. So as parents, we need to be there to let them know that they are special, okay? Now, children, initially need mom and dad for everything. As they get into the school age period, they're starting to break away from all the need of mom and dad. No, they still need them. They still need to be adults. They don't need to be friends. But these children, who's on there? Okay, I was having an echo. But these children now are starting to be able to function without mom and dad guiding them all along. And what's happening is they're getting ready to go into high school, then to go out of the house into college and move out on their own. So we're broken away from mom and dad, and we're giving some time somewhere else. They're learning other children, other cultures, other, way people think, and they're learning because of this. Play, children always play. I think we all play. I think it's the best part of life. Now, as children, you have the school age children now are playing things, and there is rules and there's rituals. So they have to follow the rules, usually with other children. So you have to cooperate because your goal is going to be whether building a sandcastle or winning the game, or having a board game and getting to home first, whatever it is. So all of these things are important. It's making them being more self-confident. It's making them think, to be creative, to think of how to win those things. And it could be just a game alone, and that's okay too, because again, you're following rules and there usually is an outcome from it. And this really helps children feel good about themselves. They're starting to be aware of what they can do and what they can't do. They know that they can't kick a ball, but they can take a softball and throw it really far. They know what they can do. They know they're good in math, but they're really horrible in spelling. So they're going to focus on their good abilities and not the ones that they can't do as well. Adults are extremely important in these children's lives, whether it's their nana, their aunt, their uncle, whoever, who is a positive, hopefully a positive role model for them. Again, learning something different than just the parents' point of view. And when they have these parents who are sitting there and making them feel good, and they're praising them for their abilities of what they can do, it does give them a lot of that self-respect. They feel good, they're happy, and that's parents and what other adults can help with. In general, these children are starting to learn about themselves, and they're not liking themselves as much. I'm too pudgy, my hair's too short, I've got freckles, I had to wear braces. They're starting to know these things, and they're also starting to know that everybody's different, that every person is special and unique in their looks. Most of the time, children, and I think even adults, they like their hair and they like their eyes. It's one of the most important things. Body image is very, very important. They're starting to dress in a manner because the other kids dress that way. As my grandson says, yeah, I'm dressed and I'm really cool today. I've got cool outfit on because I got pockets in my shorts, and that is part of what they do. They're pleasing it for other children too. And they're seeing children who have braces and eyeglasses and hearing aids. And, as long as it's not stressed as different and, there's something wrong with these children, it's like, okay, well, they have a hearing aid, they can't hear. As I said, when they go into school, we've had this nice home environment where they feel safe and comfortable. And now they're going to go and have to listen to another adult. So they're starting to get ready for when they become, adolescents and move out of the house. It's part of that growing up world. It's where they start socializing, they start learning other cultures, as I said, other opinions from other children, and it grows their minds and opens their minds to many different things. Again, peer relationships are very important, and again, same-sex relationships. Nutrition, again, always is going to be important. These children are growing. When you grow, you do need the good nutrition. And they are starting now to do these programs on nutrition. This My Plate is a computer program where they can look at what do they eat? Are they eating the proper foods, and making them aware of what's good for them? Many children at this age, because of, parents, today you need, if you're a single parent, you're definitely gonna come home from work and grab some fast food because you're just too tired today. But even two parents, you're just so exhausted trying to make ends meet and getting the house going that, you know, they're going to be eating more fast food, which again can interfere with proper nutrition, and it could go into obesity. Now, obesity today is reaching epidemic proportions. And why? Well, today children go home, pick up the iPad, their phone, the TV, and they watch it and don't move. You know, years ago, you didn't have cartoons at all hours of the night and day. It was only Saturday mornings, you know, maybe early in the morning before school, but you didn't have it. But today, you know, they're, you know, sedentary. Another thing could be is their neighborhood. You know, it's not the great neighborhood, and you don't want your children out there, which could be part of it. And we know that if you are a school-age child who is obese, overweight, this child is going to have changes in their body called cardiometabolic changes, which can lead them into adolescents and adults with hypertension, diabetes, and hypercholesterolemia. So overweight as children can become those adults with those issues. So how do we take care of this obesity? Well, it should start in utero. These babies should be fed well into utero. And then as, you know, they're infants, you know, children should be gaining double their birth weight by 6 months. Well, if they've tripled it by 6 months, there's too much food going in. So it needs to be evaluated. That's why we know these markers. You know, it's tripling by 1 year, not by 6 months. All ethnic groups are involved. It's not just one or the other. It's global. It's all types of children. School-age children, there's all these programs, like I said, that My Plate program, you know, that they're doing. I've seen programs like Dare to Keep Your Kids Off Drugs, and now there's the obesity, and it's the healthy people, you know, 2022 that they're looking at. It also has to do with obesity and making children get up and go and be out for an hour a day. So they're doing a bunch of things to try to help these children who are overweight from becoming that adult who's overweight. One of the misnomers is you sit a child down to eat, that child needs to eat everything on the plate. Now, it is said now that if a child goes in hungry, not that they've been munching all day long on other stuff, if they go into dinner hungry or lunch hungry, that you shouldn't make them finish all the food on their plate. What you've started to say is you need to eat all your food, even if you're full, and that could lead to an adult, again, with obesity. These children need to sleep 9 to 11 hours a day. The younger school-age children will fight, you know, oh, I gotta pee, I need a glass of water, I need another hug, I need a kiss. You know, that's the younger ones. But as they get older, they're like, Mom, I'm going to bed, and they get up and they go to their room, and that's the end of it. But sleep is very important. Sports are important, but again, they love a competition. They love to win. They really need to be out there. It's good to play a sport because you're, again, working with a team of other children and adults, and there is an outcome that you're striving to do. Again, remember the bullying from not just other children. I know in Little League, I hear parents saying things that they shouldn't be saying to other people's children. You know, like, you missed that ball. Hey, what'd you do there? You missed the ball. You lost the game from us. You know, and that happens. But that's why parents need to be involved. Dental health, again, we start with baby teeth. We go all permanent. We know when the all permanent come in, they might be all malocclusion. They need braces. You know, that's part of, you know, many children's upbringing. They're going to need braces. What if a tooth falls out of the mouth? Now, many children will be, let's say, outside in the park and fall off the jungle gym, and their mouth comes down on a metal bar, and the whole tooth comes out, even the root. What do you do with that tooth? Is it gone? Is it, you know, all right, now what are we going to do? You can save the tooth. and you can bring them to either an emergency room, usually pediatric, if you have a pediatric ER, or pediatric dentist. You transport that tooth in cold milk. Apparently the milk, the calcium, I don't know, the fat, I don't know what's in there, but it hypotonic, isotonic, I don't know. But they say milk is the best way to carry it. And that what they do is they'll numb the area. Many of these are front teeth that come out. In fact, it's either the bottom or the top front teeth that I've seen come out, the whole things. They numb it with LET, which is a lidocaine gel, make sure it's nice and numb, and they take the tooth and they push it up in there. And many times it adheres. So they don't have to go through a big dental bill trying to get a tooth put in there, a fake tooth. They're still very curious about sex and masturbation, and it's all normal. This is all normal part of the exploration of the body and understanding themselves. This is a time and the end of the school age area to talk about sex education, you know, whether it's a school, whether school nurse, or with the parents, talking about sex in a way that's understandable for children, because young children do experiment with things. So it's something that needs to be looked at. I think the one thing that bothered me the most in my career was a 10-year-old with a premature baby in the newborn ICU. And she had a relationship at age 10 and she got pregnant and they had her have the baby, and seeing this little tiny baby and this 10-year-old looking at the child, it was very difficult for me. Of course, I was there, supported her, but you can imagine. So information is really important, and having that open, direct line with your parents is the best. Now, in my case and many children's cases, my mother doesn't talk about that stuff at all. She, I started menstruating and said, "Mom, I'm menstruating." And she went and gave me a box and said, "Here, read the directions." That was it. So nurses roles are so important, whether you're the school nurse, the nurse in the doctor's office or an ER, whatever, it doesn't matter. Being there to be able to answer the questions and answering them in a manner, again, on the age of the child. There is, understanding that you're sexy. And then of course there's that sex. So that, telling these children, what is the difference so that they understand good touch, bad touch at this age. School health is a really great job, I think, for many nurses, because you're off all the days that your children are off. You're off for that Christmas holiday if you want, sometimes just even through the summer break too. So it is a good thing. Now, when COVID came, this group worked so hard trying to get the information out to the parents, the accurate information about COVID and what to do to keep their children safe. So they work really hard with, the community health center. They also work with the CDC, and they give the information, and they're there for education, for counseling, and to follow up if they need follow up. So school health is a very, very important part of a school age child. Injury prevention, of course, we're always going to do that. Children tend to get up and go and run out the door and, fall over whatever's there and break their arm, their leg. So, make sure that we keep these children safe. We know motor vehicles in any age is the most common cause of injury. They say a child should be in the rear seat till age 13. Now, I can't tell you, my kids at age 9 and 10 were calling shotgun for the front seat, because I was a single parent for many years and when they were that age. And they should be in a booster seat to age 8, which I think is old, but if it keeps the kid safe, and if you've done it all along, they don't know any better than just keeping them in the seat. Using proper equipment for sports, for bicycles, very important to protect these children. And the one thing that I would never allow in my house is a trampoline. I think that they fly off of them, they go through the springs, and a lot of injuries I've seen occur because of it. So, as I said, this is a hard time for parents because, you're not in total control of this child anymore, and they want to go to their friend's house. And, then that mother or father of that friend, that peer relationship, is now a part of your child's life. So you try to be there, try to support unobtrusively as possible. And we know that these children are learning from these new relationships. One of the disorders school-age children have, very common, is ADHD, attention deficit hyperactivity disorder. This is inattention hyperactivity where they cannot focus. They start a task, they don't finish it, go to another one and another one. And they're extremely disruptive many times in the school. So many times these children are sent to the school nurse to try to help the child and the family do things to help the child be able to understand their ADHD and what to do, and to try to help them with meds, no meds, whatever the decision is. Now, one of the common things that happens is nurses tend to try to go in there and say, well, you need to do this and then this, and you need to do this. Well, the first thing you need to do is listen to the parents about what they have already done for that child. They might have already done everything that you want to say. So listen to them first and then come up with a plan that you can with the family. So it's maybe something new that you can think of to help this child to be able to go to school and to be with the other kids and not being so disruptive. So a child has an avulsed, knocked out tooth. The parents are reluctant to try to reimplant the tooth. Where should the tooth be placed for transport? Where did I say?
A.
Yes, it is. It's going to be in cold milk. Yes, it is. And it works really well. Okay, now adolescence. I always said that adolescence is a roller coaster ride. You have to hold on for the ride because adolescence, these children have gone from childhood and they're becoming adults, and they're in this transition, and they are not understanding their physical, mental, what's going on in their brains. They are rapidly changing, learning, becoming mature, getting more responsibilities as adolescents, and they have to, be able to understand that. We know that children start in the beginning of adolescence and they go through this pre-adolescent growth spurt, and they go 20-25% of their height during that time, and their voices change, and now all of these sexual changes go on. The primary sex characteristics are just what's in the body to produce a child for reproduction. The secondary are things like that hormone that starts, the voice changing, hair growth, breast enlargement, fat deposits, et cetera, et cetera. And these children are like, seeing themselves. Now, in boys, the first pubescent change is testicular enlargement. In girls, the first pubescent change is breast buds. So when we start seeing girls getting little breast buds, we know they're going through puberty. This is Tanner's and the way he describes it. And it's girls and boys, and it starts with breast buds, and then it goes to full breast. It goes from no pubic hair to a lot of pubic hair. The testicles and the penis are small, and it goes into, an enlarged testicles and the hair growth also. And it is, again, a sequential thing that goes on. As I said, they do gain 20-25% of their height during this adolescent growth spurt, the very, very beginning. It's usually they can go this in 2 to 3 years, this all happens. So these children need good nutrition now. Now think about adolescents. Adolescents are all into body image. So many of them don't want to eat because they think they're too fat. and they're growing like crazy, but they're not getting the nutrition they need. So, and they're not getting the sleep they need because they're out being social or they're studying for these exams that they need to study for. Obesity can be associated with early onset of menarche in girls, but has nothing to do with boys. And when you talk about voice changes, I mean, we think of boys when they have the voice changes, but girls get it too. Think about girls who were high soprano in a choir and now they're an alto because their voices have dropped, and that's common. So here we are, Erickson. It talks about identity. Let's talk what's identity. Who am I? What do I want to be? And where am I going? This is that time where, like, I'm growing up now. I need to, who am I? Do I like girls? Do I like boys? Do I like both? Am I a girl? Am I a boy? These are all these confusions going on. Also, what am I going to be when I grow up? What group of peers do I want to be with? Is it the band nerds? Is it, the straight A kids? Or is it the choir, the band, whoever it is, they have to fit into a group now. And this is a lot of, turmoil to figure these things out. And they don't always get it right the first time. So they have to try. They're trying to be independent from the family. They don't want mom and dad to tell them what to do, but they need them when they want them. Like, Mom, can I have 20 bucks to go to the movies? I mean, that's not, uncommon. You hear that all the time with these children, but they want to go when they want and they want to come home when they want. And it's a very difficult thing to be parents now. I mean, parents still need to be parents, but you're more on a friend basis that you're able to talk with your child. It's not as much authoritarian, although concrete rules need to be there for that. Intense sociability. They want to be out, going to the mall, hanging out at the park after school. They want to, ride their bikes to McDonald's, or somebody got a driver's license. Let's go for a ride and cruise around. Sociability. And then intense loneliness. Well, let me give you a situation. My peer friend, my girl, who, my best friend, knows that I like this boy. And then I was in school and I come around the corner and she's there kissing the boy I like. I've lost a best friend and they've taken the guy that I wanted to go out with. Intense loneliness. They're so angry and it becomes this like almost depression. That's why suicide is high with adolescents, with body image and with these sort of happenings. They want to be accepted by their peers. They want to be a part of a group. Very important. As I said, parents. It starts with protection, dependency, and then it goes into this mutual affection and equality, trying to allow them to do things as long as, they're doing what they need to do. So this is the struggle between privilege and responsibility. So, parents set up the rules. You need to go to school, you need to do good grades, you need to keep your room clean, take the garbage out, whatever it is. And then you can go out to the movies on Saturday, or you can go, stay over at such and such house. It's this real struggle. Now, between the ages of 15 to 17, you're going to see the major conflicts over being independent and then control what responsibilities they want to be able to do. And at this time, it's hard. Many parents and children, they can't talk to each other, but they need to sit down and they need to set limits and structure of what they can do, can't do, what has to be done before they get privileges, and they both have to agree and understand what they came to that understanding of. So relationship with peers, as I said, peer groups are so important. They, body images are so important, and they want the peers to say, hey, man, you got a really good haircut, or, I really like those new glasses you got, or, if it's somebody who's into the group where, they're all band nerds, they went to competition and did well, and the peers are praising them. That's what they want. They really really need those sort of things. It really makes them feel a sense of belonging and feeling strength and power, because I got people who understand me, because mom and dad don't understand me, but my buddies and them do. So peers are very important. Now, best friends are basically your peers, but they say how you treat your best friend in adolescence is how you're going to treat your partner for life. So if you see somebody being really nice to their best friend, probably going to make a good partner, later on in life. Now, this is the hard part. You get a child, an adolescent, into your doctor's office, or they're into an emergency room, whatever, and you need to sit down with them and talk things. And especially if you talk that sexual talk, very, very hard to talk about. Now, what we recommend is, just like we go to the young children and break the ice by sitting down first, telling them that, your lit up sneakers are so cute, and that, oh, that Batman shirt, I really love it. And how are you doing at school? Or, I love your eyes, beautiful, beautiful eyes you have. So now you broke the thing. Well, in adolescence, you're going to talk about, so what did you do this weekend? Did you see a good movie? Or, have you decided where to go to college yet? Or, I hear you play football. How was your game the other day? So now you've broken the ice in a different manner, but the same way. Now this adolescent will feel more comfortable talking to you. Now, when it's all about sex, many of these children will not talk in front of their parents openly and honestly. I know I wouldn't say nothing about nothing, but how do you as a nurse take care of them? Could be a young girl who's having her third urinary tract infection in 6 months. It's probably due to some sexual activity that's going on. And how are you going to know if there's sexual activity? Well, have the parent walk out of the room and talk to the child alone. Now, you do not have to tell the parent what the child said, unless it's some sort of behavior that is dangerous to them or others. So you can keep it in confidentiality, and you can teach. Now, when it talks about sex and sexual contraception and everything, your opinion, it doesn't matter. You don't say what your opinion is. You give them facts, you give them information in oral and written form. And that is how you work with adolescents. Now, another thing that's going on today is there's girls who want to be boys and boys who want to be girls. Now, this goes really close to home to me because I have a stepdaughter who's a girl who wants to be called Ray now, and she dresses more masculinely, and that's fine. But what if I had that child in the emergency room? I would ask them, what do you want me to call you by? Because her name is Rachie or Rachel. Well, she wants to be called Ray. And that is giving that girl, I understand you, I will call you Ray. And that makes them feel safe. That makes them feel that they're accepted, and now they're relaxed, okay? Because this is happening today. It's more out than ever. Years ago, you wouldn't. Everybody was hidden. But thank goodness people can be themselves today. In adolescence, we're going to be given the HPV vaccine to prevent cervical cancer. Again, as I talked about, nutrition is important because of these growth spurts. They tend to grab a Nutri-Grain bar and a bottle of water and run out the door for the day, and they don't eat because body image. They need to be skinny, and they need to be, fitting into those size 4 jeans, which is ridiculous. But this is what these adolescents do. So if we're having issues with an adolescent, whether obesity or just health issues because of poor nutrition, keeping a 24-hour diary can help determine what's going on with that child. Sleep and rest, they should be sleeping as much as infants almost right now. Didn't I just talk about this huge growth burst, just like infants do? But they don't, because they are into these social things. They're out in the movie and parties and meeting after school and playing basketball, whatever. Or they're at home doing their schoolwork because they want to get into that college and they need their A. So they're not sleeping the way they should. So it can affect your child. They should exercise a little bit, and again, taking care of their teeth. And as simple as brushing twice a teeth with floss can help improve dental health. Sex education, as I said, how to talk about it. Years ago, we didn't have sex on TV when I was a young child. I remember when Lucille Ball and Ricky Ricardo had a bedroom scene, and it showed their bedroom. It had 2 single beds. That was the talk of everything. Like, how dare they show sex on TV? It was a huge thing back then. Today, they're just having sex on TV and it doesn't even really matter. So children are seeing it. So parents should be open with children and talked about them. But if you can't, like my parents, I couldn't, there are school nurses. You can speak with them and it's a great resource, or Planned Parenthood today. Again, safety, promotion, injury prevention. These children now got licenses. Now they're driving. So again, motor vehicle accidents. They're becoming more explorative. They're taking out the gun and looking at it because they're big now. And of course, it can go off in injuries. And of course, sports injuries. And we always need to do things to prevent and make sure that they don't have injuries, by proper equipment and education. So Matt, age 14, is always eating, although his weight is appropriate for his height. The best explanation for this could be what? What do you think? It's normal, absolutely normal.
Normal.
Hey,
Yeah.
absolutely normal that a 14-year-old is eating like crazy. Remember, he's getting really tall, and he needs that nutrition. So who wants to win the Kahoots today? Anybody? Do I see little hands? Nobody? Come on, Mary, you're smiling. You want to do it? Okay, there you go. All right, Morgan wants to. Mona? Yeah? Maybe? Okay.
Courtney Walton wants to.
Courtney? Okay. All right, let's see who wins. Let's go. All right, let's get going. Dexter with a drop of blood. Okay. School age, adolescent children. How does the onset of the pubertal growth spurt compare in girls and boys? So we know girls, it starts pubertal growth about age 10 and boys at age 12. So it's about 2 years and the girls are first. And LP went up first. At what age should a parent expect to have major conflicts over independence and control with their child? And that's about ages 15 to 17. It's not early on in adolescence. It's like right there in the middle where, I'm now in 10th, 11th grade and I'm cool and I'm doing fine. So I want to do what I want to do. And I'm going to do what, I'm controlling it. And, of course, parents don't do well with that at all. The onset of puberty in boys is characterized by what? So it starts with testicular enlargement and then it goes on from there. And what about girls? Signs of onset of puberty in girls starts with what? And we know that's starting with the development of breast buds. Yes, it is. And in the end, they're full breasts. The source of injury, whether intentional or unintentional in adolescence, is associated with what? And then I'll say, does it matter what age of injuries in children? And we know that's motor vehicles. Good job. I think we understand that concept now. If a parent feels uncomfortable about talking about sex education, who's a good resource? And we know that school nurse is a great resource. Again, you also have Planned Parenthood if there's one available. A 9-year-old's friend tells him soccer is a dumb game and he should play baseball. What's this kid gonna do? What do you think? What's that all about? I mean, it's his friend. As again, when you're talking about these school-age children, peer acceptance is important, and he's probably going to play baseball, not soccer. Allie's up top. During admission, the father of a 16-year-old says we are Buddhist. Culturally competent care includes what? So whenever you don't know about a person for whatever reason, the first thing you need to do is either ask the child or ask the parents. In the end, they will be so appreciative that you did, and you save time by doing that. Example, so maybe a Buddhist is don't want the daughter being taken care of by a male nurse. You've made the assignments already, and now you've got to change the assignments to accommodate that. So when you ask, you already know. And I'm telling you, parents and children appreciate that. When teaching sex education and contraceptive for adolescents, what should the nurse consider? So again, when you're talking about sex education, contraceptive for adolescents, number one, not your opinion. Your opinion doesn't matter. You need to give them information orally, educate them, and then give them something written for them to read. So you're giving them information, and you do not need permission from the parent to give them information if they ask. Mars on fire. A multi-select. The management of adolescent obesity should include well, we know that 24-hour diary is absolutely what you need. And the other thing is, they're not going to want nutritious food. They're going to want something they like. They want to have their ice cream on Sundays, whatever it is. And diversion works for young children. It doesn't work for adolescents. So 24-hour diary and incorporating some favorite foods is what we need to do. Infants go through a predictable sequence of growth and development. What is this called? Now, these are some things that you've seen in your reading. You've seen it in your interactive PowerPoint. We've discussed it, in class about these. This is, talking about infants, but I will go back to last week's stuff on some very important concepts. So sequence of growth is sequential trends, okay? So the word was in there. And understanding the different ones. They know there's a certain sequence that children go through. They lift their head, they turn front to back to front, and they get on their knees. This is sequence. They know this is going to happen. Which of the following drugs is the most common drug of abuse in the adolescent population? And it's alcohol. I mean, I can't tell you how many children have told me that they used to take the alcohol out of the mother's liquor cabinet and then fill the bottle back up with water so the parents didn't know that they were not getting what they should get. It's easy to get. Alcohol is just easier to get for children or adolescents. Which benchmark serves as the ending period for the school-age children? So school-age children, what is the ending of it? We know that school age level, you're almost 12. And that's when puberty starts. That's when all the permanent teeth are in, and that's the end of school age. And that's what that question meant. A little bit redundant in the wording. An example of indirect bullying would be what? We know in schools and everywhere bullying is such a big thing, but it can be also now putting it on one of the websites, whichever the one of vogue of today. And it's very upsetting to these children. I've actually seen some incidences where social media was used to make some comment about child, and the child was so upset with it that they got so depressed that they committed suicide. So bullying social media is a really real thing. What action would improve dental health in the school age child? So brushing their teeth, yes, but using floss does increase and improve dental health in children. I mean, everybody. Generally, the earliest age at which puberty begins is. Now, I'm not talking about precocious puberty. That's ridiculously young. This is normal puberty, usually. I've mentioned it already. And it's 10 in girls, 12 in boys. Very good. That's why boys are stupid when you are, 10 years old. They're just silly and they're stupid and they don't know any better. I remember saying it. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Is this real? Do they do that, 8-year-olds? Remember, this is very, very common. I gave you the example of the boy going for an appendectomy, and that appendectomy, they felt that they were being punished because they hit their sister, and making sure that child knew that they didn't do anything wrong was so important. Courtney's on fire now. A 5-year-old needs to get a chest x-ray. What explanation is the best? So again, it's a camera, take a picture, and we're going to look at your insides. And that will eliminate a lot of fears on children, especially when you're talking the younger side of these school-age children. And even the toddlers, you can use that with too. How do you get an adolescent to open up about their sexual history? It's like opening up about anything. It's going to the young child and get on their developmental level and talking about, their beautiful eyes or freckles. How are we going to go to an adolescent and have them open up about anything? And it's like, tell me what's going on in your life. What are you doing? What music? Hey, what was that song? I heard something on your phone. What are you listening to? It does. It opens it up, makes them feel relaxed, and they'll be more apt to talk to you, really. How do you get an adolescent to be more receptive to talking about their health and sexual exploration? The girls had 3 urinary tract infections in the last, 6 months. How do we have them talk to me? Get the parents out of the room and talk to the child. Again, you don't have to tell the parents what they said, unless it's something that they're doing could hurt themselves or others. A multi-select. When educating adolescents about risks for HIV and hepatitis, what would you include? So you're going to, of course, the best thing is abstinence, whether they do that or not. We understand adolescents do what they want. Just simple hand washing can help. And of course, condoms is the other thing that we would use. Courtney's still on fire there. A child has a knocked out tooth. Where should the tooth be placed for transport to the dentist or the emergency room? And that's in cold milk. It works well. A nurse planning care for a school-age child should know which thought process is seen. School-age children. I was talking about Little Debbie cakes. And that's the ability to conserve, that they know that this is all they have and it has to go for this amount of time and that they will make it go there, or they know they don't have any more. What stage of Erickson would you use for a school-age child? Remember we talked about school-age children with Erickson, and children, school-age children, love to be able to do something well and get praise from it. They also get very frustrated when they can't do everything well. They can't master all the tasks. So it's industry versus inferiority, okay? School-age children love to be praised for doing things well, get frustrated because they can't do everything they want well. A multi-select. Anorexia nervosa is characterized by, now in adolescence, there's 2 eating disorders, and I just give you a couple of slides about them here in the Kahoot. Anorexia nervosa is when adolescents feel they're absolutely too fat, and they could look as skinny as this picture here. They don't want to lose weight, and they do not eat at all, okay? Now, conversely, bulimia is the other eating disorder. They eat food like tons and tons of food, but they eat it and vomit. So they're able to taste it, but they're vomiting. Now, how would you know on a skinny child, are they anorexic or are they bulimic? Well, if you're vomiting, purging and vomiting all the time, you're vomiting the gastric acid juices and you're going to rot your teeth. So a bulimic child would have rotten teeth. An anorexic child would not. That's the difference. How do you know if you suffer from bulimia? Very good. That's the binge and purge. Watch programs where they take big baggies and vomit into and save it and put it, away so that nobody knows what they're doing. I just can't imagine. I can't. The leading cause of death from unintentional injuries in children is, all right, that concept is very well understood now. We know it's motor vehicle. Good job. Adolescents are what? So they are stuck between being a kid and being an adult. And this is a time of much confusion and being so troubled and frustrated because they are looking for their identity, according to Erickson. Courtney's in second. She trying. What's an adolescent heart rate? I gave you a big list of all of the different children and all the different heart rate and respiratory rates. And you need to know those things when you're assessing children. If you're going to give medicine like digoxin, or are they dehydrated? Do they have a fever? Knowing what's elevated or not. So adolescents tend to be slightly lower than adults because they're more active than adults. So 55 to 90, not 60 to 100. Now, 60 to 120, 120 is too high. It's going to be lower. 120, they've just ran around the corner, or they're dehydrated, or they have a fever. When talking with an adolescent regarding personal health concerns, which is most important? Yes, let the child, the adolescent, well, almost adult, talk to you realistically. Now, I'm telling you, adolescents love to tell you things that they want to see a shock value in your face. So be prepared for them to tell you some crazy things. Say, oh, okay. Okay, how'd that make you feel? A parent says the infant put everything in their mouth. Based on Freud's theory, you would respond what? Infants, everything in the mouth. Freud is all just oral, not sensory motor like Piaget. Freud is biting, sucking, chewing. This is how they get derived pleasure from, and that's Freud as an infant. And Julie's on fire. In addition to injuries, a leading cause of death in adolescents ages 15 to 19 years are what? And it's homicide, suicide. Remember, adolescents are going through that stage of body image and not liking their body and wanting to be accepted by peers. And when they don't, and there's intense loneliness, you worry about suicide. Also, they're in exploration, doing things that they shouldn't. They could be, picking up guns or driving a car and not driving it properly, which can cause them to hit people, and homicide. So homicide, suicide are that adolescents. In school age, conflict of industry versus inferiority. What does industry mean? Remember, children, school age children love to be able to do something well and get the praise. That's industry. That's mastering the task. And the inferiority is what they can't do well and they're frustrated because they want to do everything well, which not everybody can do everything well. At what age does intuitive thought start? And that's your early school age child. That's being able to put things together and understand the reasons why things are done, being intuitive. Julie's still on fire. Which age group prefers to be with members of their own sex? No, we talked about school age children. We know they love same sex, that's for sure. Adolescence just wants peers. It doesn't mean it has to be a same sex. So this is when you start talking the later stages of school age. They want to be with their own sex. They're more comfortable there. Which age group would have a tendency towards eating disorders? And that's, of course, your adolescence, because of body image is all about how they look. True or false? Home support is invaluable to the adolescent. Do they need their home? Do they need mom and dad? And actually they do. They need to be there to pick up the pieces. They need to be there to give them some guidance as they go along. You know, what happens if you saw your best friend kissing the guy that you liked, and who's going to be there to support you? It's going to be mom and dad. So you do need your home support. As much as you don't want it, you still need it. You know, I need it as adults. I still want my mommy to hug me. Contraindication to administering the varicella vaccine to an adolescent. Well, let's look at the question very carefully. Varicella vaccine, chickenpox vaccine, is a live immunization, live vaccine. What do you know about that? Doesn't matter if it's a child or an adult, it doesn't matter. What is one of the big concerns with giving that? And it's that immunosuppressed thing. You are immunosuppressed if you're on corticosteroids, steroids. So you cannot give it if they've had it. Okay, does that make sense now? You'll see that question in MedSearch too, guaranteed. And you might see it in the pediatric. And I put it there just to bring up that concept to you. Live vaccines, immunosuppressed, you can't give it. To improve adolescent health, adults must increase health enhancing behaviors such as, what do adolescents need to do to be healthier? So they need good food, they need to sleep and exercise, and probably they're not eating good, they're not sleeping good, and they probably are too busy trying to get the homework done, so they're not exercising. And if they did that, they'd actually feel a lot better. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? Which one of these is not anorexia nervosa? I think the other symptoms are talking all about hypothyroidism if you look at it closely. When you look at dry skin, intolerance to cold, constipation, that's all hypothyroidism, but it's also due to no nutrition from anorexia nervosa. There's nothing to support you. but you're not going to have decaying teeth. That's the vomiting. That's the gastric juices of bulimia. So yes, good job. You listened well. Thank you. The risk of depression in transgender children is what? You know, today we're getting more free to be who we are. And remember, not everybody is accepting anybody because they're different. And, you know, it's a shame. We are all people, we're all human. So helping as nurses, these children to accept themselves, you've got a vital part if you ever run into this and work in the field of pediatrics. A 14-year-old in the emergency room after a biking accident. How should the nurse interact with that adolescent? You know, they've come in probably off a helicopter, they're on a backboard, neck brace, taped to a board, and they're scared, and everybody's running after them, into them, cutting clothes, starting IVs, x-rays. It can be really intimidating. So as a nurse, what I would do, stand by the head of the bed, say, a lot of people's coming at you quickly. Nobody's going to hurt you. They're going to cut this. They're going to do an x-ray. Tell me where it hurts. Do you have any questions? And answer them. And you'll get everything done quick, and you have stopped the fear of that child. I've seen this happen so many times, and they're flipping out because everybody's running in and they're afraid you're just going to stick them and hurt them everywhere. So as a nurse, you have a responsibility to that child, whether they're a little child or a big child. Cooperative play, what is that? Play is so important. Cooperative play is when you have 2 or more children working together and they are doing a goal. It could be building blocks, building a house together. That's the goal. Or it could be playing a game that there's an end to it. This is the difference between cooperative play or associative play. They play together, but they're not working towards a common goal. So understanding the different types of play, you should know them now. What does moral development involve? Who talks about moral development? Morality. What is morality?
Kohlberg.
Absolutely. Good and bad, right? Good and bad and the consequences for them. The only thing the school-age children does with that is sometimes, even if they're wrong, they want to do it, even though there's a consequence, because they needed to, for whatever their reason is. Younger children, they're not going to do it if they get punished. School-age children, adolescents, oh yeah. Developmental milestones are important to observe because of what? Why do I need to know all about these sequential trends of lifting head and turning over and walking and chest and head circumference? Why do I have to know that stuff? Well, if they're not meeting milestones and they're behind, I can do early intervention and I can help that child get caught up quickly. If we're not looking at children and looking at developmental milestones, then this child is not going to grow as quickly as they should cognitively, could be gross motor, fine motor, whatever, but we can put early intervention in there and help the child. Lymph nodes in children with normal findings should look like what? You shouldn't be able to feel them at all. Good job. The right second intercostal space landmark of the heart is called what? You know, we will be assessing children and we'll be assessing all the different areas of the heart. What are you listening to at that point? And this is your aortic valve, you know, going back, health assessment, something you need to review, something you're going to be seeing again. Which nerve controls critical movements of the tongue? And that's cranial nerve 9, the glossopharyngeal. And they stick their tongue out. Blah, 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 blah. And yes, your nerve is intact. It works. What type of breath sounds do you expect to hear over the trachea? Remember, trachea is upper. We're going to hear all of this here. What is those breath sounds called? And that is called bronchial, okay? That's all the upper airway. Knowing the difference that there's upper and lower airway in children. You don't hear this in adults. This is specific to children. Depriving a child of food, clothing, and shelter is the definition for what? And that is neglect. Food, clothing, and shelter is neglect. And it is reportable. If we see that going on as a nurse, we should report it, you know, to make sure that child is being taken care of the best they can. Which of the following immunization is given in the adolescent stage? And that's your HPV virus, okay? We can give any vaccination to an older child if they've never gotten it before, but the one that's specific that we give for the adolescent is the HPV virus vaccination, preventing cervical cancer in the girl. ADHD most likely involves which of the following? And inattention, impulsivity, hyperactivity, inability to complete a task, and disruptive in the classroom. Very good. And last question. Adolescents typically place blank on peer relationships. Absolutely a high value. They really need to be needed by their peers. Gives them comfort. Number 3, Courtney. Good job, Court. Number 2, LP. Number 1, BCS, whoever BCS is. Is that you, Brittany? Julie? And Ali, 4 and 5. Good job,
Yes.
guys. I
you.
thought so. Good job. It's fun to do these things and, you know, be able to answer a lot of them. It makes you feel, okay, maybe I guess I was listening well. Please sign your attendance attestations, make sure that they get done. Just to let you know, I'm here later on at 5:30, about an hour from now. I'll be giving the first review and you'll be getting those recordings starting tomorrow. So if you want to come to the review, please, I'll be here, okay? Anyway, thank you guys. Great class as always. Remember, next week is your exam. I wish you all the best. Any questions, just holler at me and I'll talk back with you, okay? Thank you guys.
Have a good day.
You too.
Is the review going to be recorded?
Absolutely.